This is our cold opening. Aaron, I think we should sing for our cold opening.
You can sing.
Fine. Start it however you want to start it.
Hi, everyone. Welcome. This is Body, Brain, and Pain. I'm Dr. Erin Babineau, an orthopedic specialist and pelvic health physical therapist.
And I'm Dr. Kayla Conway, a pediatric physical therapist that specializes in chronic pain.
In this podcast, we are going to continue to dive into the ideas and research around why we hurt, the confusions and misconceptions that come with this, and how to be the best advocate for yourself in our ever-changing healthcare system. Kayla, I'm so glad that we have you back with us.
Oh, it's good to be back.
Permanently.
Woohoo!
I'm so excited to have Kayla on here with me. She is so killer at her job, one of the most empathetic people I know, and so passionate about what we've been talking about on here. If you didn't catch Kayla as a guest, she is on episode 12 on restoring resiliency and hope. Again, Kayla is a dear, dear friend of mine that I met during our physical therapy doctorate program at the University of Minnesota, but also my personal mentor on pain neuroscience. So I am one spoiled lady here. Kayla is one of a handful of pediatric pain physical therapists in the United States. Kayla treats some of the sickest kiddos I know and specializes in chronic pain. And why, Kayla, do you think I picked you as my co-host?
I mean, besides being awesome, no, I am here because I truly, legitimately love being a physical therapist. And I look at it as I am literally living out the mission of this podcast every day.
Truly. I think you were the
Truly,
first one who pushed me to record.
Yeah.
Yeah. I remember we were in your hallway chatting at 10 p.m. talking about pain science.
As we do, as naturally we just do, because that's how we live our lives.
And yeah, Kayla makes me do hard things, and that was good. When we should remind people what the mission of our podcast is.
Yeah.
Now that you're on here.
Absolutely. Yeah. Mm-hmm. So remember, the mission of this, the reason, we're doing this is for everyone. It's not just for physical therapists, for medical providers. It is for everyone. We believe legitimately in our souls that when you know better and understand better your pain, you're able to control and gain that control of your body and your health.
Absolutely. Yeah.
I even had a colleague a couple of weeks ago ask me if I hated giving advice to colleagues, because she was starting to ask me about an ache or a pain or something. And she asked me if I hated giving advice to colleagues or friends. And I, of course, responded, it depends on who's asking. but because, and I was like, no, not usually. Honestly, I love being a physical therapist. And if I can give something to someone who functionally can make their lives better, then that's what I want to do. Mm-hmm. And I think as physical therapists, our knowledge base, it feels like the most functional knowledge base that you can have.
Yeah, it's so awesome. I always say that. And people, I think I've said this before, but they'll be like, man, Erin, thanks for just philosophizing with me today and giving me advice. And I truly am it's not just that we believe it, but there's actually really good freaking science on it.
Exactly. And we are just making that science digestible for people.
Let's help you digest it.
Absolutely.
And, we need to do a better job of that. And that's why we're doing this podcast. And we truly want it to be approachable, and please continue to send us questions and things you want to learn about. So, I love inpatient or acute care physical therapists. Kayla is one of them most of the time. She also is an outpatient once a week. Sorry. Yeah. You guys manage all different types of pain at different parts of recovery. And I think it's important that people know what this looks like, just so they kind of understand you a little better, and also how many different areas physical therapy comes into play.
Yeah. As an inpatient, so in the hospital physical therapist, I am seeing people from when they're admitted into the hospital all the way through to when they discharge. So I'm going in, day one after surgery, and I'm getting them up and moving. And day one, I'm starting, and I'm not blowing smoke, I'm starting this pain conversation. Day one, I'm normalizing that they just had a major surgery. Of course they're in pain. Their body is responding to this major surgery. I'm educating them on ways to work through their pain. I'm actively, functionally working through that pain with them. And then I'm, the most importantly to me is teaching them functional ways to actually improve their pain while we're getting up and moving. And then, like you mentioned, 1 day a week, then I'm in outpatient too. So then sometimes, if I'm lucky, these patients come and see me personally, then in outpatient. But of course, any one of my colleagues, it would be great at working through these things with them. But being able to talk, okay, now you're home. Now what does this look like? How are we going to, heal from this, major surgery going forward now that we're out of the hospital?
Again, giving people autonomy. So you're really teaching them, I call us tour guides all the time. Totally. Because our end goal is truly that you fire us once you know all the great things that you can do and what your body can do.
Our job is to work ourselves out of a job.
Exactly.
We do not want people to rely on us every day for the rest of their lives.
It's the coolest thing ever. And you have really sick people.
Yeah.
Real sick.
Yeah.
And you were on COVID unit. You were doing that too. So, you've had people who are on a lot of things, a lot of support, medical support, and then you are getting them moving, which is pretty phenomenal because we know the positive impacts of movement.
Totally. Movement is medicine.
Medicine.
That's what we say all the time. Movement is medicine.
Well, I'm so excited because, truly having your outlook and voice on here will give us so many different perspectives. Physical therapy is in so many settings, you guys. So outpatient is what you think about in my office, so your typical clinic. Inpatient or the hospital, which is Kayla most of the time. Transitional care units, subacute rehab, home health, pelvic health, school systems. Man, we're just everywhere. We're taking over.
Yeah. And you mentioned that, New York Times article last episode. You and Michelle were talking about what to look for in a physical therapist because there are so many different physical therapists in so many different areas. So, you got to figure out which one's right for you. And,
Yeah.
That article talked about not all PTs are created equal. So you need to find a professional who values evidence over anecdote.
You guys on this podcast, you have 2 no bullshit PTs, physical therapists.
Totally. And, when you're looking for a physical therapist, you can ask those questions of what do you treat regularly? What patients are you comfortable with seeing? At the very least, you can ask whoever's scheduling you, whether it's a central scheduling person or someone at the front desk, you can be asking them, the physical therapist that you're setting me up with, do they commonly treat persistent pain? Do they commonly treat knee injuries? Those people should know who can treat what you need.
And it's usually on their bio if they do have an online presence a little bit. You can see that.
Yeah.
So that's helpful. So you can look into that a little bit with the world of the internet. And then there's all these certifications, so we go and get our doctorate. Most of physical therapists have their doctorates, which is so wonderful. We've now transitioned, so we know if you're fit to be there. And then there are, residencies and further training, which is what I did in orthopedics, and then some specialty exams because, God, we know we love to give tests. And but you can see that. I'm just kidding. It is good. But you can see, if someone has an orthopedic specialty or something that has a further training with residencies and stuff like that. It's kind of,
and the reality is, when you become a physical therapist, whatever setting you end up in, you gain your skills going forward in that setting. So based on the patients that you end up seeing in your clinic, those kind of end up being your specialties. And it in turn, informs the kind of continuing education that you go for. We have to take continuing education. When I say we have to, we want to. We constantly have questions about how to best treat our patients.
Lifelong learners, best thing ever.
Yeah, so we're continually going to continuing education courses, and I can't tell you how many times I'm like, oh, I see this continuing education course is coming up for, well, at one point it was persistent pain. And I was like, I'm going to that course because I need to better be able to treat these patients. Yeah. So that's, sometimes that's how you find your passion areas, but sometimes they just find you, kind of how persistent pain found me.
And positively, the world is changing with that. So now, yes, most physical therapists have their doctorate, and then they're teaching pain neuroscience education in the school, which is so great.
Yeah, we didn't get that when we were in PT school.
We did not. It's just Kayla and I love talking about the science behind pain neuroscience. But we remind people it takes 17 years for this information to get into clinical practice, so the pain neuroscience. And it's been around for about 20-ish, so it's not new, but we're newly talking about it. And this is only a good thing because we do think it's only better from here, and it's why we're doing this podcast, why we're talking about it, why we want this to be approachable for everyone.
Totally, because these can be hard conversations, 5 to 10 years ago, people didn't know what persistent pain was or how pain worked, and they were told that their pain was in their head, that it was psychosomatic. And, we know now, and, it's more widely taught that, we know that pain is processed in your nervous system. And that's why we're doing this. We want to normalize this information. We want to spread this information. We want people to understand it.
Yeah. And 45 miles of a nervous system.
Yeah.
Kayla was the person who told me that fun fact before I went and got more training.
Yeah. And I always try to tell people, okay, so what's 45 miles away?
Yeah.
What city's 45 miles
Hudson,
away?
Wisconsin. I worked in Hudson. Call out to Hudson, Wisconsin. Yeah.
45 miles away. So that's and I had a kid last week who said, but that's a really long way. How is that all in my body? I said, I know, right?
You're like, tell me.
They're real cramped up in there.
Mouth dropped.
Right?
Yes.
Mind blown.
Mind blown. My mind was blown. I was like, no freaking way, Kayla. You've got to be kidding me. And this brings up, truly the best physical therapists, and I'm like really pumping up I love physical therapy. I think it's the future, but are truly the ones that have no egos. We really, I always remind people, even with these tough conversations, like we want the same thing as the people that we treat. We want you more functional, and we want you to have less pain, because it is all about living your life and connecting with yourself and others. So
right.
Last week I had someone get kind of upset with me, and I just said, hey, get what you need to get off your chest. This is totally fine. This is the time for it. Like tears, laughter, that we do it all in the clinic. But can I just remind you, like, we literally want the same things.
Totally.
We want the same things.
We're literally only doing this because we care.
Exactly.
It's not like we're doing it for the money.
No.
But you know what, Erin? I think this is a good place to end. But I want to start a new tradition on this podcast.
Okay, what do you want to do?
Can we start ending our podcast the way that I end my PT sessions with people?
Yes. What is that?
My last piece of homework for them is that they need to do something they enjoy this week. So, Erin, what did you do this week that brought you joy?
Yesterday, oh my goodness, I hung out with all my physical therapy friends from school, including you.
Yes.
Call out University of Minnesota, class of 2016. And it had been, I think, over 2 years since we'd all gotten together.
Yeah.
Since before pandemic time.
Since our friend's wedding.
Our friend's wedding. And we swam in the pool. We laughed. We shared a meal. And, it felt so good. Brought me so much joy.
That's what I was going to say. That was what brought me joy this week. And man, it felt good. We needed that for sure.
Kayla, I am so happy you're here.
Erin,
new beginnings.
I'm so happy to be here. This is going to be so fun.
It's going to be so fun.
All right, you guys, have a good week and take care.
Bye, everyone.
See you next time.
See ya.